We have standing by from the Department of Public Health and Social Services, Janella Carrera, who's the PIO for the agency. Good morning, Janella.
Hey, good morning, Chris and Bree. How are you guys doing?
Doing pretty good. And she's joined by Chima Mbakwem, who's the infection control and the medical operations chief now with public health. Good morning, Chima.
Good morning.
Well, and I know Chima's kind of limited on the time, so I guess we'll jump in with Chima. Bree, go ahead.
Okay. Chima, I wanted to follow up on the rapid engagement team deployment to GIGO last week. Have you guys had a chance to look over the data and what is it saying?
Yes, and I think if you look at the JIC reports, the reports from the department, we actually posted the numbers of cases that we got from the place. But we've also gone forward to contact the individuals and successfully isolated and quarantined their contacts.
Mm-hmm. Are they, I think the last time we spoke with Janella, it was only 2 that were isolated at the government isolation facility. Is it still just the 2 out of all the people that tested positive?
For that particular event, at that point, it was just 2, yes.
Okay. What about are there any plans for any other deployment of the rapid engagement team? I know that it's not just GIGO, it's Northern Guam. Are there any plans to head over and do testing in Dededo? Or back to GIGO?
That question is based on the data that is available to public health. You know, the rapid engagement team is actually a more proactive and active case finding for public health. So it is just doing what we're doing every day, but deploying the whole team to a particular community, mostly hard to reach communities or areas that we identify through our data from the surveillance and data that we have that needs outright intervention at that point. So the deployment team is there, just that they need to be activated when there's a need for that. But we continue to do what we're doing every day.
Mm-hmm. So is there any need right now to deploy the RET?
That will come from the deployment actually comes from the direction of the incident commander and the director of public health.
Okay, so no deployment on the radar anytime soon.
No, they will be the ones to answer the questions. When the data is presented to them, they decide and then they deploy. So I and the other members of the deployment team will go out to actually operationalize the data that comes from leadership.
Mm-hmm. You know, we had Dr. Howell Wynn on last week, and I think it was a focus because you were at that public hearing last week also on quarantine and isolation facilities. And something that Dr. Hoa had mentioned was this COVID clinic for home isolation individuals. Can you give me your thoughts on that and whether you think that is a good idea to have a COVID clinic for people that are on home isolation? Because he was saying something like, they could go there daily.
Yeah, I think every idea at this point is welcome, you know, and is always well taken by public health. The other thing is how to operationalize the good ideas. That is what we always do at the back end. You know, we have a lot of ideas and strategies, and then we're slowly and then gradually shifting to those new strategies without disrupting what we're doing every day. Like I said, every idea is good, but operationalizing every idea, you know, takes time and resources and commitment. So we welcome the ideas, and then we look forward to, you know, working with any good ideas that will help us reduce the transmission of COVID on the island.
Is it something though that public health is seriously considering?
I think the fact that we have a lot of people with underlying medical conditions, some of them not well managed on the island, is a whole lot of concern, you know. And I think providing any kind of medical need that these individuals will have is welcome. Like I said, I truly accept every good idea that would help us reduce the transmission on the island. Is just to operationalize it. So some good ideas might take longer time than some other ideas, but we welcome those ideas.
What's the status on the isolation and quarantine facilities, Chima? Are we good with those? Do you anticipate a greater need, and maybe the Gov Guam having to go out and get another facility? Are we good?
Yeah, I think the way we are moving now is actually to provide more education about quarantine and isolation. The definition for isolation and quarantine is basically the same, and the location becomes another situation. And the reason why public health and the government has been working towards providing the quarantine and isolation facilities, just not because we want to send people out of their homes. The fact is that looking at the multi-generational families that we have on the island and the chances of transmission at home, the public health is trying to promote the use of the government facilities to stop transmission at home. So I think we are working towards expansion and also inform people that is an option that they really would consider if there is any reason for them to think that there will be ongoing transmission in their homes.
Did the issue of sanitizing and disinfecting the rooms at is it Bayview, the government isolation facility at Bayview? I know that was an issue with people who were who wanted to avail themselves of the government isolation facility there, but there was an issue with the rooms being sanitized. Was that ever resolved, Janella?
Yeah, I think that was worked out with the contractor.
Okay, but so we're still only using the Bayview and not Garden Court, or both in use now?
For now we're still using Bayview, but there's always plan for expansion. You know, if you're looking at our average cases every day, and like I said, the multi-generational household and the need to cut off transmission, there's a need for us to continuously educate people on the need to use the isolation facilities when they think there is going to be transmission at home.
Have you had any instances where people may have had positives in the home and may have been in a home that was maybe not up to what they need to adequately self-isolate the positive cases from the other people in the household? Did you come across any situations where people were just like, no, we don't want to go, we'll just tough it out here?
Yes, we have. You see, that's why it's challenging, because that is an individual decision to make. We cannot force people out of their homes. So it takes a lot of tact and education for us to get people out of the home. And most times, you know, because of the experience of the team that I'm working with, sometimes they will not achieve it in the first day, but second day they can. Most instances, people, when you tell them about their positive result, it's difficult for them to, you know, to work it out at that point. And at the same time, if you're suggesting that they should leave their families and their loved ones, it's also becomes more like it becomes a more added burden to them. But when they process it, most times they call back to ask for the government quarantine. Yeah.
Right. Has there been an instance where you had people refuse to go to the isolation facility and then the virus spread from the positive people in the house to the negative people in the house?
You know, right now, the determination of who is infecting who is not scientifically proven, like TB, where you can do the genome sequencing to find out what is going on. But right now, you know, is who you test first, you know, and then maybe someone you test first in the family might not be the index case, you know, and right. then after your case investigation, you test other family members. Some will turn positive, some will turn negative. But that determination is just not easy to make.
Chima, we had Dr. Ann Pobutsky on Friday, and she had told us about a World Health Organization designation, and that she was in communication with them to move Guam, I think, to a level that basically translates to widespread community infection of the virus. Is that accurate? And how serious is it? Because I almost feel like people are just getting numb to these numbers and these deaths. I mean, just from an infection control standpoint, because that's what you do, right? How bad is it?
Yes.
Right now?
So I think a lot of people are in denial, because the fact is that we are actually in a pandemic. That is the definition of what is going on. It's not an epidemic. It's not concentrated in just a particular place. It's all over the world. And if you're looking at the numbers all over the world, even in continental US, the number of new infections and the number of new people and the number of people dying, I think it should be a concern. And it's time for people to really change their behavior. This disease is driven by behavior and culture. And if you look at our numbers, and if you look at the concentration of the virus now, you're seeing that is in the home and is in the workplace, where people are lower their defenses. When you're at home, you want to relax with your family. You don't use the non-pharmaceutical measures that public health is promoting. So looking at just the numbers, it's almost like playing. It's almost like Russian roulette. Is 20 today, is 15 tomorrow, is 10 tomorrow. That is not the driving force. The driving force is human beings. If we sit down and actually follow recommendations by CDC, WHO, Guam Department of Public Health, we will see a decrease in these numbers. But people are clearly not looking at it from that point, because we look at the numbers, it goes up and it comes down, and we're like, okay, it's here to stay. It's here to stay, but we can actually fight it off by changing some of the behaviors that is consistent with some people, not wearing their mask, not going with the recommendations from the public health officials. That is the driving force. So I think we humans should sit down and take a moment to think about what role we're playing in the transmission of this disease. This is not mosquitoes. Mosquitoes, we can't blame anybody but blame our individual attitudes and behavior for the rise in these cases. I think it's time for us to sit down and really look at each of us individually, to look at what role we play in either reducing this virus or increasing the virus in the community.
What do you think is really going on? It's you're right. The numbers just keep going up. It's really scary. It really seems like nobody
cares.
Yeah.
Care more about dining out
what
or dining in or whatever.
more do you think we need to do?
I think, like I pointed out, it's an individual decision to make. Am I wearing my mask? Am I washing my hands? Am I keeping 6 feet away from the next person? These are personal decisions that individuals have to make now. It is not for public health to make those decisions. We have brought out the recommendations for people. Then it's up to them to do it. And we also need more education. I think this is the time the community, like the media, the churches, the community-based organizations should come out and support public health and the community, to keep reinforcing this good message. Wear your mask, stay away from other people, wash your hands, and then we can see these numbers start coming down. So I think it's more of a community effort now than trying to make it, it's more like a community effort. Let me just leave it there. We just need to come together.
Right.
Chima, anything in closing here? Because I know you got to go before we talk about Halloween. Kind of seems weird telling us how serious we
Yeah,
are, and then
and
it's
then-
like, yeah, what about trick-or-treating? What about duty-free?
Yeah. Yeah, I think it's hard, for a lot of us also, coming to realization that a lot of the things that we're used to doing, we're not doing it because of this pandemic. But the fact remains that it's a pandemic. There's a problem. We just need to slow down a little bit, try to accommodate the new norm, and then figure out how to continue moving forward until we have a vaccine or we have a cure. I think the public health recommendations is still the best way to go for now.
Thank you, Chima.
Thank you, Chima.
Thank you so much for having me.
Of course, our pleasure. Come on back on anytime.
If you invite me, I'm approved.
It's an open invite. I'll give you the password.
Okay.
Thank you, Chima. Janelle,
All right,
you're gonna
thank
hang.
you so much.
Okay, yeah. Janelle, you're gonna hang, and we're gonna talk a little bit about Halloween. And did you have any other insight into the testing or?
I know that you guys were working with the FSM Consul General Office, and you guys had the GIGO testing at the GIGO gym. Is there anything else planned?
Yeah, so we are still working with the FSM Consulate Office and the FSM Organization or Association of Guam. We are planning another one. We're looking at some areas and other possible venues that to hold another testing or another outreach. We'll probably be making some announcements soon. There's some areas that we are looking at. So hopefully in the next, maybe even possibly today. So possibly today or tomorrow, we'll be making that announcement soon on the location and the time for the community, the next community outreach.
And the community.
I think we just need to meet maybe one last time or a couple more times to solidify that plan.
And again, this is to reach out to people who have the high infection rates and the lack of access to health. Okay.
Right. And it's going to be similar to the GIGO gym outreach, where we'll partner with the FSM Association of Guam, and they'll be the driving force for registration. So registration will occur with the FSM Association and the consulate office.
Okay.
Hey, Janella, do you know, because we saw with that ethnic group breakdown, it was the FSM at the top, and then it was Caucasians, and I think it was it Den Chamorro? Anyway, is there any effort to kind of fold in these other groups that were identified through the data to go in and see what kind of testing or engagement we need to do with those other groups?
I know that we're also looking into the Filipino community as well. But right now that's still in discussion. We're still working really closely with the FSM community because we know that the disparity is the highest among that population.
Have you guys gotten any word back from the Attorney General's office? I know that you'd mentioned you guys were waiting for guidance and an opinion or something like that.
Yeah.
With respect to
As
enforcing.
of this time, right. Yeah, as of this time, we still haven't heard. I'll check with the environmental health team because they're the ones who put in the request.
Okay.
But so far, we haven't heard anything yet.
Yeah, I did reach out because
I will follow up.
when we had you on last week, I reached out to Carlina Chatfirst over at the AG's office, and kind of said, "Hey, public health keeps name dropping you guys. Where's this opinion? Where's this guidance at?" And she told me that it was attorney-client privilege, and they couldn't tell us anything until they or
Until
whatever
it's official.
until it's official.
Right.
So that's where we're at. Let's go to Halloween. Are you good, Bree?
Yeah.
Halloween guidance, Janella? It was kind of like, don't do it.
Yeah.
But if you do it safe.
Right,
Yeah.
right, exactly. So, yeah, we issued our Halloween guidance over the weekend, and we're asking people to please be safe this Halloween. There are safer alternatives that you can do, some activities that you can do in lieu of trick-or-treating. We ask, ultimately we want you to stay home as much as possible. There are some companies, I believe GPO made an announcement on how they're planning to do Halloween. It's a curbside drive-through, and I think even Dr. Shea is planning to do something similar with his clinic. because he has a one-way in, one-way out. And it's also drive-through, curbside trick-or-treating. But, at the top of our guidance, we remind everybody that, we're still under an executive order where congregation limited to 5 people or less. So, we're still enforcing that. If you're going to go out, make sure it's 5 people or less, stay within your own household. And we still strongly encourage people to please wear your mask and make that a part of your costume. For those who are going to be distributing candy, we ask that you don't use your hands. So try to make it, contact less, without making contact with others. Use a spoon or tongs to distribute your candy, and also individually wrap it if you can. And then, when you're going out trick-or-treating, if you decide to, we ask that parents be the one to pick up the candy and not the children. Some of the safer alternatives that you can do for trick-or-treating, or for Halloween rather, you can take pictures, you can decorate your home, decorate your pumpkin carving. And then also for those businesses who want to engage in Halloween or trick-or-treating, we encourage you not to do, the traditional trick-or-treating like we see at the mall, where you do it inside the establishment. We encourage you to do the drive-through curbside. And if you do decide to do that, the recommendations are that you do it, you ask your patrons to turn off their AC, ensure that they don't exit their vehicles. So just similar to curbside drive-through, retail, it's the same thing with trick-or-treating. And we do, we ask everybody to please wear your mask or make it a part of your costume.
Do you guys anticipate public health kind of going around, or is that GPD's role going around and making sure no one's having a super big Halloween party?
We are looking to GPD. We do have that partnership with them to enforce, the congregation limitation. But, our public health team, our environmental health team, they have been very vigilant in going out, responding to complaints, but also regularly going out as well. But again, this is not to intimidate our, we want Halloween to be fun and safe. So, we'll be out there monitoring, but, ultimately we want people to comply. We're not looking to punish, but we just want to make sure it's going to be a fun and safe Halloween experience.
Thank you, Janella.
Thanks. So what are your plans?
You know what? So my kids, I've figured out a way to incorporate masks as part of their Halloween costume. They want to be Among Us characters. I don't know if you're familiar with the game. Yeah. Oh, you are? Okay.
Well, I'm not.
Yeah,
Jason
so-
is. Jason
Oh
is.
yeah, well, figure the nerd would get it, right?
He's a player of games.
Oh, is that Jason who said yep?
Yeah,
Okay.
Yeah.
of course.
The nerd gets it. Yeah.
Okay, I play it too. So the mask is going to be, the little visor thing. over
Nice.
their face.
Okay.
Yeah, just like, yeah. So that's part of their costume. So they're going to be Among Us characters. I think I might be an Among Us character too.
Oh.
Little family of imposters.
Right.
So that's what we're going to be for Halloween.
Well, thank you, Janella.
But we're not going to go trick-or-treating. We'll probably do the curbside drive-through thing.
Right,
Maybe.
yeah.
We'll see.
All right. Thanks, Janella. Stay safe.
You too. Thanks, guys.
Okay, wash your hands. Oh, what do we have, Jay, in the K-Wave News Zoom room? Virtual.
Well, today we got lobster mac and cheese. We went big.
What?
Damn, dude.
Oh, Lillian's going to love that.
Oh, yeah.
Lobster